Hi, everyone. I'm going to start us off in just a minute. I just know we have a few more people joining, and there was a little change. So I just want to give people a little bit more time to hop on, and then I will get us started. And check our numbers here. 13. It's great to see you all. Okay, well, I do want to be respectful of everyone's time, and I know we have a lot to cover today. So I want to thank you all for joining the Spring Vermont Oral Health Network meeting today. And we're joined today by the American Institute of Dental Public Health, and we're going to hear about veteran oral health in Vermont. So I am going to turn things over to Liz and Shayla to present more about that. So thanks so much for being here with us today.
Thank you, Robin, and thank you everyone for being with us here today. I'm Liz Flannery. I'm the Director of Education and Leadership here at the American Institute of Dental Public Health. And I'm going to start sharing my slides here in just a second. And then I'm going to pass it over to Annalise Cothran, our co-founder and executive director, to share our presentation with us. Welcome everyone. We'll go over this in housekeeping, but as folks are coming in, I think some folks might be still coming in from the waiting room. We invite you to join on camera. This is designed to be very interactive. So please share in the chat. Please be on camera as you are able. And also just noting, I know we had some technical difficulties with our link. So thank you everyone for your flexibility and jumping on our new link and your grace with that piece. So without further ado, I'm going to mute myself and share my screen.
Hi, everyone. Welcome. We're so glad that you're here today. Thanks so much for joining AIDPH on our virtual road tour, hopefully to all 50 states at some point. We've made it to about half so far, sharing what we know, what we've learned, and also learning from all of you what you know about veteran oral health here in Vermont. So while we're waiting for the slides to appear, here we go. Our agenda here today is pretty simple. We are going to start with a national overview of veteran oral health to create some context around what the national landscape looks like, some of the data, some of the information and available resources, followed by a highlight on Vermont and veteran oral health in your state. We're going to create some opportunities for discussion. Like I mentioned, this is really bi-directional learning. So we know that all of you are experts in what's happening in Vermont, and we want to hear from you as well. Then we'll end today with some action items and next steps. And Liz, just FYI, we are seeing a black box on the side of your screen. I don't know if you can see it on your side, but it's kind of like a gray box. So while you're looking into that, you may want to stop and reshare. I will also say, just from a housekeeping perspective, a couple things here. We are recording this session. We will make it available on the AIDPH Academy, so you can certainly go back and revisit this session whenever you need to. All of the materials from today are available on our website, but more importantly, they're available at vetdentaldata.org, which is where you can find your profile in all 50 states, along with tons of publications. And we're still seeing that black bar, Liz. And we also would love to hear from all of you. So if you want to type your name and email into the chat, that way we can make sure that we know who is here and how to support all of you. And if you'd like, Liz, I can also share my screen.
I'll try one more thing real quick.
Okay. You know what? I'm just going to be real honest. We've had technical difficulty after technical difficulty today, and this is not common. This is not common for us. We are very polished people, and I know we're internally dying just a little bit that we've had so many issues. Normally it goes off without a hitch, but you know, this is life. Okay.
Is there a black box with that, Annalise?
We can't see just yet, but I also have the slides pulled up on my side and I'm happy to share if I need to.
Okay. Maybe that might be best. It's showing that it's sharing from my side, so.
Okay. Still seeing the black box, so I'm just going to
Okay,
take it over.
I will pass it over to you. I'm so sorry.
That's okay. No big deal. Okay. Here we are. So throughout today, we want to learn from you and we want you all to learn from each other. We found that these events are more engaging if we're all participating. So one of the ways that we're asking you to participate today is through our audience engagement tool, Slido. So you can join us at slido.com and type in that meeting code, or you can scan on your screen that QR code with your phone. I believe we're also popping that into the chat. So you can find the link there. Okay, so while you're bringing that up really quickly, our learning objectives are here. You can earn CEUs for today's session. And let's start with our first poll. I am interested in hearing what brought you to today's session.
And
Okay.
Annalise, I'm just gonna, since you swapped over to sharing, excuse me, you might want to pop the Slido into your browser on the other tab so you could toggle over to the poll if you're able to.
Yep, I got it. Okay, so I'm looking now at the poll. You should also be able to see on your side what brought you to this session. I'm seeing all of the above from everyone, which is we all want to share, learn, connect. 20% of you are looking at learning, which is great. I hope we all learn from each other again. And most of us want to do all the things. So that's great. These are our disclosures. We don't have any. We are your hosts today. Thank you so much, Robin, for being so generous and gracious and supporting this effort, and also bearing with us as we had our technical issues this morning. Okay, so let's head to our next poll. What do you believe are the top priority areas for veteran oral health in your state? So based on what you know, what you've experienced, and perhaps what you're interested in, what do you believe are the top priorities for veteran oral health in Vermont? So as you're sharing that, I'm seeing right now, most of you who have responded, which is just one so far, access to care, which we're all deeply concerned with that. I'm glad to see we have alignment there. Integration with general health care. I think we all understand the connections between oral health and general health. And we're going to review those in today's presentation as well. If anyone else would like to hop in, now's a good time. Top priority areas for veteran oral health in your state. Last call for a response. Okay. So we will head back over to my slides. Thanks so much for weighing in. So let's go ahead and start today. Now that we understand where our priority areas are, which is access to care, learning about care integration, and it seems like all of us are here to learn and connect with each other, we can go ahead and hop into our introduction. Just in case you don't know who we are, that's okay. AIDPH is a national 501c3 nonprofit. Our mission is to empower communities to advance oral health through research, education, and advocacy. And veteran oral health has been one of those areas that span all three, research, education, and advocacy, which we'll learn about together today. Our vision is a justice-oriented oral health system for all people. We have 4 core communities of focus. That includes veterans, of course, which is why we're all here today. It also includes queer people, people with disabilities, and people living in rural areas. There's actually a lot of overlap between all of these communities. And in particular today, we're going to be talking about veterans who are disabled and veterans who are living in rural areas because there's a lot of compelling data, both in Vermont and nationally, to talk about those overlapping issue areas. Among our core communities of focus, as I mentioned, there are about 1 million veterans who identify as queer and about 90 active duty queer service members. Veterans disproportionately live in rural areas, and taken together, we really focus on this common experience of historical exclusion and marginalization from healthcare systems, which we know perpetuate poor oral health. We also want to thank CareQuest Institute for Oral Health for funding this work. And throughout this time together, AIDPH and CareQuest have been working on veteran oral health since about 2021. So initially, we were approached by CareQuest, and I was asked, what do you know about veteran oral health? I was actually pretty embarrassed. I don't know if you've heard me tell this story before, but I was embarrassed initially when I was asked that question because I said nothing. And that was embarrassing for me because I am actually the spouse of a veteran who is a Purple Heart recipient. I've been a military beneficiary in the healthcare system for the past 15 years. And I had never considered this intersection of my personal and my professional life. And so that really set me on a mission of saying, well, what is out there about veteran oral health? And what I realized at the time in 2021 was that everything I could find essentially fit on a page. There was really no research, there was really no advocacy. And quite frankly, the healthcare system for veterans is just so limited that there really wasn't a lot of information. And that's where we started this work. We started it with research, and then our research was able to inform our advocacy and our education efforts, which brings us to today, where we have an entire website dedicated to veteran oral health and supporting state work in Vermont and in other states as well. So let's start with the basics. What does veteran oral health look like? So the VA is in charge of providing care to veterans. And this might be familiar for some of you, or this might be new information. So let's all start on the same page, which is that the VA, excuse me, pardon me for that interruption. So the VA provides both medical and dental benefits for veterans. However, the VA does not confer what benefits veterans are allowed to get. The VA is really the coverage arm and the care delivery arm, but Congress is actually the arm that defines the benefits that the VA is allowed to give to veterans. So anytime there's a change to VA benefits, it does require congressional action, both through the budget and appropriations process, and also the defining and the eligibility process. Right now in the US, most veterans are not eligible for dental care through the VA. So when we look at the entire spectrum of veterans here, which is about 18 million veterans currently living in the US, if you look at the bar across the top, this visualization, about half of veterans are eligible for medical care through the VA. The other half of veterans we don't know a ton about. Those could be veterans who are accessing dental care through the private sector or medical care through the private sector, through TRICARE, another DoD defined, it's very separate from the VA, or private sector care. The other half, the darker blue here on the left, are veterans who are eligible for medical care through the VA. So that means about half of veterans, 9 million veterans, can get their medical care through the VA. They can go to their medical appointments, but about 75% of them leave those medical appointments without eligibility for dental care in the VA. So about 25% of veterans are eligible for dental care. The good news is the PACT Act that was passed in 2023 did increase that significantly. So before the PACT Act, we were sitting at about 15% of veterans who were eligible for dental care. Now we're sitting at about 25% of veterans who are eligible for dental care, which is really wonderful. One major barrier is that most veterans are not utilizing that benefit. So that tiny red bar that you see represents about a third of veterans annually who utilize that benefit. So we know that most veterans are not eligible for care through the VA. We also understand that among those veterans who are eligible for dental care, they simply aren't utilizing it. And we don't know enough about why. We focused a lot of our work on chronic disease conditions in veterans, which I can see from the poll earlier. This is an area that many people are interested in. So let's dive
Hey,
into.
Annalise, can I chime in with one question from the chat?
Oh, yes.
Deborah was asking about eligibility, and I think she probably popped it in as you were speaking about it, but I just wanted to check in and see if there was any clarifying questions you had, Deborah, or if that piece just covered it for you.
Thanks so much for flagging that.
No, Joe responded, and I think he provided the answer partly.
Yeah, well, it is actually so complicated. And Joe's right. The bulk of eligibility is determined by that disability benefit. So we understand that most veterans who are eligible for dental care are likely given that 100% disability rating. But eligibility is essentially determined by Congress, and then also care is delivered by the VA. So Congress determines how eligibility is defined through Title 38 of the Federal Code. And fun fact, we have not reevaluated that in over 70 years. So it's certainly time for an upgrade. And then Judy, I am so sorry if you thought that I was supporting that 25% is wonderful. I think it's wonderful that we've had an increase of 10% since 2023 when the PACT Act was passed. I am in no way saying that it's wonderful that veterans are not able to access dental care through the VA. We want to make sure that all veterans, and we have promoted this policy now for many years, all veterans should be getting care through the VA. We have supported legislation at the federal level now for many years and have worked with Senator Sanders' office to get that to happen. Congress has not agreed with us just yet, but I'm glad to see that we have lots of interested folks who want to make sure that we're all aligned in getting veterans into care. And we believe that it's Congress's job to pass legislation that expands equitable oral health for veterans. Thank you for bringing that up. Okay, so let's hop a little bit into chronic disease in veterans. Again, this was an issue area that all of you said you were interested in via our polls, so I'm so glad we have some data here to present to you. We have focused on chronic disease in veterans in relation to heart disease and diabetes. I'm sure all of you with an oral health background understand that these are chronic disease conditions that disproportionately exacerbate poor oral health. We also know that these are high-risk, high-cost conditions. And as you can see from the data, they disproportionately impact veterans. So chronic disease in veterans are higher compared to chronic disease in non-veterans as a result of military service and connection. So even after controlling for factors like income, education, and rurality, veterans with diabetes are still about 40% more likely to be edentulous than veterans without diabetes. This is a really profound oral health impact. Edentulous means you have no natural teeth left. Similarly, with heart disease, veterans were about 30% more likely to be edentulous than veterans without heart disease. Again, we know these are high-risk, high-cost chronic disease conditions that disproportionately impact veterans. And what our research has found is that if we are investing in addressing these high-risk, high-cost chronic disease conditions, that we can save taxpayer dollars. So for every dollar saved in diabetes management through the VA, we get to save $1 in comprehensive dental care. So essentially, our argument has been that we get to cancel out all of the money that we spend by giving veterans comprehensive dental care. We get a medical cost savings on the back end, which is really exciting. And we find that that is actually doubled when it comes to heart disease management. So for every dollar spent in giving veterans comprehensive oral health care, we can save $2 in medical care. So again, these are taxpayer savings, high risk, high cost conditions that allow us a lot of flexibility in how we're able to support these veterans within the VA. I will also note too that the VA is the largest integrated healthcare system in the United States. So that means that the VA is really an opportunity to be able to save the most money by keeping care in the VA, where medical and dental are all treatment planned together for the veteran. I mentioned in the beginning that we would talk about rural veterans because veterans disproportionately live in rural areas, and all states have rural areas. So this is important for everyone to know. Veterans living in rural areas have poorer oral health outcomes than veterans living in non-rural areas. So when we're looking at the breakdown of oral health outcomes, we know that veterans, compared to non-veterans, have poorer oral health and higher rates of chronic disease conditions. We also understand that veterans living in rural areas compared to veterans living in non-rural areas also have poorer oral health outcomes and higher chronic disease conditions. Veterans living in rural areas visit an emergency department more frequently to take care of their needs, and they are less likely to qualify for VA dental care compared to urban veterans. So this is a particular high need area and a subpopulation to pay attention to. You can also get an entire dashboard on the vetdental.data.org website, specifically looking at rural veterans. We have a lot of different health indicators that you can certainly explore, and every indicator that we can get by state is available by state. Unfortunately, not all of the data that we're able to access has state level insights, but we do have regional level insights on rural veterans, including healthcare costs and access. So we invite you to look at that. I'm going to highlight a couple of things here today that are on our dashboard in relation to rural veterans. And Liz, I don't want to toggle too much back and forth. So if I am unable to flag a question in the chat, just let me know.
Yep, absolutely. I think we're good so far.
Okay, perfect. So I'm just highlighting here the cost among rural veterans, and you can look at this in detail, but the long and short of it is that rural veterans pay more out of pocket than urban veterans. They are also more likely to be unable to see a dentist or avoid seeing a dentist either due to cost or difficulty finding a dentist. Rural veterans have more oral health issues. They say that they are more likely than urban veterans to indicate that they avoid smiling, that they feel embarrassed of the state of their mouth and teeth, or that they struggle with functioning. And the problem is, we know that this disproportionately impacts other areas of life, including mental health, employability. And so rural veterans are certainly an area where we need to focus on and create more legislative support. Because you're in Vermont, I also want to point out that Senator Sanders has been such a champion of rural veterans and has introduced legislation to support rural veterans. So we know this is being focused on at the federal level as well as the state level. We have lots of available research on vetdental.data.org that highlights all of these statistics, but also we have 2 entire publications dedicated to rural veterans. If you want to learn more, again, it's very hard to find state level insights on there, but we do have lots of national policy and research to support veterans living in rural areas. We also have, again, as I pointed out, a dashboard where you can look at state level insights, but also we have profiles built for all 50 states. And so that's what we'd like to jump in now. So what does veteran oral health look like for the state of Vermont? Inviting you to hop into Slido as you're thinking through what your state looks like. What do you expect or anticipate or currently view as your state's biggest challenge for veteran oral health? Okay, see one person typing. What do you think Vermont's biggest challenge is for veteran oral health? And in case you're joining us a little bit late, that's okay. We're here at slido.com, and you can see here what the meeting code is. If you would like to join in the conversation, we invite you to do so. And you can share what your biggest challenge is for veteran oral health in your state. So access, I don't think that's surprising at all. Finances, difficulty finding a provider who accepts veterans. I can totally see that. Coverage, insurance. So a lot of this is related, I'm seeing, to access, but also financial barriers to care. And that's pretty common in all of our states. Okay, I'm going to hop back over to the slides. So
And
let's talk.
Annalise, oh, I'm
Yeah.
sorry. Sorry to interrupt. I think Joe, you're saying you wanted to say something about access.
Oh, perfect. Yeah,
Was there
Joe,
something
hop
more
in.
you wanted to share?
Yeah, actually, I do. So in Vermont, I have been, we were very fortunate that Northeast Delta Dental um, provided Vermont with a $100,000 grant for uninsured Vermont veterans. And that began in the fall of 23. And through that, we were able to, or I've been able to coordinate with a few of the FQHCs, which allows for preventative care for our uninsured veterans. A lot of the veterans in Vermont that I've dealt with, and I've spoken with over 200 of them, it is the fact that they will call a dentist and there are no dentists available. And that's probably true around a lot of the states where there's just lack of dentists to provide the care. And it's because it is the affordability part of it. Here in Vermont, of course, being a rural state, I agree. I'm looking at the statistics that you provided are, I mean, pretty pretty much that's the way it is here in the state. And many of them are frustrated because they can't even afford the preventative care. So the grant that Northeast Delta Dental provided to us has allowed for a number of veterans to at least go in and get some preventative care and know what their issues are and then go from there.
That's so fantastic, Joe. And I'm glad that funders are also focused on this issue. I think CareQuest has brought a lot of attention across the nation. And I also see that Delta Dental has supported some of our work in Iowa. And it's great to know that they're also supporting work in Vermont. This is clearly an issue and a major gap in coverage as well.
Yep. Thank you.
Well, thank you for sharing those insights. And if anybody else has insights to share too, please, we're keeping this informal. We want to keep this conversational. So feel free to hop in. Also, speaking of hopping in, let's take a look at Vermont state profile. We invite you to pull this up on your site as well. We're just going to, capture some screenshots and go through what your state profile looks like.
Annalise,
Yes.
Annalise, may I just take a moment and weigh in on that last comment? The mantra that we hear over and over again is that we don't have enough dentists. And I think we need to start rethinking about providers. It isn't that we need more dentists, we need more providers. We need more people that can provide basic dental care to the underserved population, of which the veterans in our state are a part of that underserved population. And it is important for everyone here today to know that dental hygienists can be trained to do simple, basic nodule fillings, and they can fix dental decay. And there's a way to do that. And we have actually a mechanism. We have a clinic scenario ongoing right now in the state of Vermont to provide that type of care at what we refer to as our pop-up clinics. And I would like to, at some point, maybe after this meeting, talk to people, some of the people here on this Zoom, about how we might be able to take that pop-up mechanism and use it to help the veterans of the state of Vermont. So anyway, my 2 cents.
No, I think that's fantastic. And workforce, I think, so workforce is an issue we've been hearing about and we'll probably never stop hearing about post-COVID, right? We have a strain on our oral health workforce in every state. And while recovery has been, slowly increasing, we know that most states are struggling with an adequate oral health workforce. And so that disproportionately affects populations like veterans who are already struggling to access care, especially in rural areas, and to get their care covered. So you're bringing up a really important point, and I would love to be able to workshop some of this in the discussion later. There's certainly opportunities for us to talk about next steps. So you're bringing up a great point, and I'd love everybody to kind of hold on to that, and we can talk about it probably in the next 15 minutes. And I would love to hear more about how Vermont is addressing the oral health workforce and how we could leverage those solutions to help veterans and their access to dental care. Okay, any other comments before we hop into the Vermont state profile? Wonderful. Okay, so hopefully folks have been able to pull this up on their side of the screen. But we start all of these state profiles the same way, which is an overview of veteran oral health. We did provide in this presentation the most recent numbers. So these profiles were developed in 2023 prior to the PACT Act being passed. So that means, again, we've seen a 10% increase in veterans who are eligible for dental care that were possible through the PACT Act, which is great. We also have just a general overview of what Vermont looks like in terms of where veterans live, how many veterans are living in rural areas, and the counties that we should be paying attention to that veterans are living in. We give this overview right at the beginning because these state profiles are not only for you all to utilize to learn more about veterans in your state, but they are also great tools for conversations for stakeholders who may not be familiar with what veteran oral health looks like nationally and in your state. These are tools for conversation and discussion with decision makers who really may not have the context that all of you have. That could be a funder, that could be a legislator. So we're trying to make these really tools for discussion and also for decision making and identifying solutions and next steps. So one of the reasons why we're pointing out all of the access and all of the accessible information rather for rural veterans is that Vermont really does have a high concentration of veterans living in a rural area. And we also have in this next section comparing Vermont to what these national statistics look like. And I just see, I'm going to pause right here because I see a question from Robin. Is the PACT Act threatened by cuts to the VA? That's a great question. I don't have a good answer for that. To my knowledge, there is no current conversation about rolling back the PACT Act. My understanding is conversations right now in the VA are mostly around workforce and what potential cuts they may or may not be making to federal workers within the VA. I have not seen any discussion otherwise, but we are paying very close attention to that. So thank you for that question. I agree, there are many unknowns. So taking a closer look at veteran oral health in Vermont, again, it's always helpful to know where your state stands in comparison to national indicators. So that's what we've presented here today. We also have just quick facts on those high risk, high cost chronic disease conditions. So you understand where Vermont compares in terms of indentualism, heart disease, and diabetes. Again, we try to present this as simply as possible because the intention is to create a conversation tool and create information that is easily understandable by a broad audience of stakeholders. The last thing that all state profiles have is a report card. And I think we are all familiar with what a report card is and how that can be a tool for developing baseline metrics of where we can increase our support and also look at where we're doing things really well, right? So we can look at the places where we have opportunities to improve, like insurance rates, but we also know that comparing here in this chronic disease section of diabetes, we're actually doing okay. And so these are also places where we can have conversations about what we're doing well, what we should keep doing, what's working, what are we doing to address these needs for veterans and people broadly in Vermont, what's working, but also where we can focus our efforts toward improvement. You can also look at your state and other states through our interactive dashboard. What we found is that this dashboard is really great for folks who are looking to make decisions about veteran oral health and wanting to compare how their state looks in conjunction with other states. It's a very easy way of kind of giving a broad overview of what veteran oral health looks like in these primary indicators, but also rolling around and seeing what that looks like in other states, especially for a legislator where you may want to make a case for improving access to care, creating some sort of solution that increases awareness or increases coverage, or all of those other things that you talked about in terms of wanting to address in your state. This is a way to get them to have easy information. So again, this tool, this data and these state profiles are ways for you to create conversation, but they're also tools for you to give to decision makers as you're having these conversations about what veteran oral health looks like in your state and beyond. Okay. So I'd love to sound off in the chat, but also feel free to come off of mute if you'd like. What is one barrier in the data, or that, I'm sorry, that isn't in the data, but is very real for your veterans in your community? And we've talked about some of them. We've already hit on workforce. We've already hit on the lack of care coverage and needing additional financial support. And those are things that we can't capture in the data. That's not publicly available information. These are stories that you would know that are specific to your state. So is there anything else that you want to share in the chat? Or again, feel free to come off of mute in terms of a barrier that isn't in the data, but we know is important. I see Deborah added dental anxiety. Thank you so much for highlighting that. I think mental health is a really critical aspect of veteran oral health care, and sometimes the data can be really difficult to get, but you're right. Anyone else have thoughts or ideas here?
Annalise, I think that there's a lot of veterans who are in the generations where we weren't talking about the importance of oral health as much, and they're just not aware of how it impacts their overall health. So getting the dental literacy raised is an important piece of it too.
Absolutely. Yeah. So, you know what? You bring up a great point, Jennifer, because when I talked in the very beginning about that 2/3 of veterans who are eligible for care through the VA but don't get care through the VA, we don't actually have a lot of data as to why. Like, we have some assumptions. It's probably difficult to understand your benefits. We have some data, some survey data from veterans that indicates that's probably part of it. And we also have an understanding that the VA doesn't have enough clinics, and sometimes community care can be difficult to access. But I think there's, like you mentioned, a need for oral health awareness and really understanding the importance of your oral health and how addressing your oral health can also help you with your diabetes, with your heart disease, with your overall health. And making that connection clearer is certainly an area that could address that 2/3 and beyond. Transportation, that is great, Gail. This comes up every single time we do these VRTs, is that getting to a VA dental clinic or community care clinic is so difficult. And it's not just about having a ride or knowing where to go. Especially when we're talking about veterans who are disabled and have complex needs, transportation from rural areas and even urban areas can really be a barrier to accessing care. Any other thoughts come to mind for folks? Okay, I'm so glad that Shayla also talked about trauma-informed care. I think that's just a critical piece of clinical care delivery for veterans, really for all people, but veterans in particular, especially given combat experience, and then just general military experience. We know that veterans disproportionately experience trauma. And so really investing in trauma-informed care practices for this population helps reduce anxiety, as Shayla pointed out, so that's great. But also means that veterans might feel more empowered to take care of their oral health, like Jennifer was mentioning, in between those dental visits. When they have a really positive visit with a clinical care provider, they may feel more empowered in their self-care in between those dental visits. Okay. So we've talked a little bit about this, but let's dive into how you can use your state profile. Number one is advocacy. And we look at advocacy in a variety of ways. We like to talk about advocacy with big P policy and little p policy, right? So big P policy are passing bills, looking at legislative opportunities and solutions for improving veteran oral health care. But we can also talk about little p policy, which is policy guidelines for clinical care delivery, like we just talked about, looking at trauma-informed care, creating clinical practices that make sense for veterans, and also looking for social changes that improve access to care. Ensuring that people are aware of veteran oral health and that they can create solutions at their community and state level. It doesn't just have to be a systems change when we're talking about veteran advocacy. Educating stakeholders, as we've already touched on, is a really important piece of veteran oral health. That could mean educating veterans themselves about their own oral health, which we just talked about, but also sharing with your state dental directors, with other decision makers who are adjacent to veteran oral health. These tools in your state and also the other publications that we have listed in vetdental.org can help create those conversations. It gives you the opportunity for a rubric of what to focus on and why. And then you can take it from there. You can really make these profiles your own and add to them in the packet of information about veteran oral health for your state. We try to make it as easy as possible to have these conversations and improve this education piece. Decision making, we've talked about that. If you are looking for ways to implement solutions or interventions for veteran oral health, hopefully we've given you some things to think about today, focusing on rural veterans, focusing on health literacy, focusing on concentrating on those chronic disease conditions. These data can help you create the most effective decisions for interventions and also help other decision makers with identifying solutions moving forward. Lastly, which it sounds like you've already been really successful with, so I want to congratulate you on this, but you can seek funding. If you can show that there is a need in your state, we want you to meet that need through funders who are invested in creating change and helping veterans access equitable oral health. So these reports can help you with seeking funding, again, from decision makers. They can also help you with reporting out outcomes in your state and generating opportunities for improvement, right, through those baseline statistics. And if you think of any other ways that you might want to use these profiles, I would love to hear that. Feel free to pop that into the chat or come off of mute. Okay, so let's talk a little bit about that. Speaking up for veteran oral health. Sharing your story like you all have here today is critically important to advancing equitable oral health. Things that you can do for veteran advocacy include joining your state coalition, which it sounds like you already have a healthy infrastructure and support system for that activity. You can also use this data for credible local city councils, state legislators, congressional representatives. We also have a veteran oral health storytelling forum on our website. And I'm wondering if maybe Shayla, you might be able to pull that up and drop that into the chat. We use veteran stories all the time throughout our work. In fact, if you look at our research and publications, you'll often find quotes from veterans like, you know, I live on a fixed income and I'm retired and I can't afford dental care. What are the options available to me? Some of the stories we've heard from veterans are, I'm living in chronic pain, and I really don't have the money or the availability to meet that need. What can I do? Those stories are often really powerful in the advocacy process. So you can do things like add to our veteran storytelling forums, start your own, use those for veteran advocacy. Talking about educating to empower, our goal is to use these profiles to build understanding and partnerships. Again, this seems like something you're already doing in your state, but hopefully these tools can help sustain and extend the infrastructure that all of you have already created and started. You can use these profiles to lead talks at your organizations, meeting with partners, collaborators that maybe haven't been engaged in this process yet. And when stakeholders are informed, they ultimately become allies. And that's our ability to build momentum toward this common goal, right? And leading into that, hopefully, this is giving you some sort of tool to inform strategic decisions. Whether you're leading a nonprofit or managing mental health or working at your state government, advising on policy, hopefully these data and the ones that are specific to your state, those aspects that are specific to your state, can help you in that strategic thinking. These data can help you make a case as to why you want to invest resources with key decision makers. And then again, as we mentioned, this helps with evaluation and reporting in the end too. You know what indicators to focus on and also where you can indicate improvement by giving these baseline data. Whoop, sorry. And lastly, we talked about grants and applications. It sounds like you really understand that funding ask, and we want you to be funded well and sustained in this work with veteran oral health. So this is a great way to start a grant. Problem statement in a grant gives you state-specific data and also the national landscape of how you can use your work in Vermont to inform other broad strategic decisions as well. Okay. So I would love to hear in the chat, but also feel free to come off of mute. Which of these have you already been using, or which of these feels most important to your role or your organization in terms of how you would use these state profiles or these data? Okay. So while folks are thinking about that, the uses for these profiles, I'm going to do a little bit of spotlighting. I'm actually going to skip this poll and instead go to this policy advocacy spotlight. So we want to highlight all of the different ways that states have invested in veteran oral health at the state level. We've talked about policy at the federal level. We know that that does take congressional action. We know that there has to be a mechanism of addressing eligibility in the federal code and also a budgeting and appropriations process for change at the federal level. We also know that takes a lot of time and energy, and that process does not move quickly. It doesn't mean we should ignore it, and AIDPH is certainly working on it every day, but there's a lot that you can consider at the state level too in regards to improving veteran oral health, and we'd like to highlight 3 states who have done this. Number 1 is Florida. Oh, let me pause there. Robin, go ahead.
No, I was going to respond to the question, but you go ahead and finish first, and then I can.
Why don't you respond to the question and I'll pause.
Okay. So just in thinking about what we've done in the past, first of all, that report card is so motivating. I hate to see a C, so looking forward to doing what we can to increase that grade. But one of the things that we've done in the past is communicate with our state VA folks to talk about changing policy. Is something I had mentioned in the chat earlier, integrating that minimally invasive dental care that can enable practices to see more people and also reduces fear and anxiety with treatment. So I was just thinking about that's one of the things we've done. And that also made me think, like, what you are doing with these state road shows is great. And I'm wondering, does the federal VA know about this effort, and are they open to the feedback that you get from states when we're thinking about how we can improve oral health for veterans.
That's a great comment and question. So that's wonderful that you're seeing a use for these tools in your state and have already been using them. So that's great. I'll respond with to your question about the VA. I'll respond with, in my opinion, and observation and experience, the VA is doing everything they can for veterans. I truly believe that. I have spoken to so many VA dentists who are not there because they make the most money and they're rolling in the dough. They're there because they deeply care about veterans. And the VA is so limited in what they're allowed to do because those guidelines are set up by Congress. And because Congress has to appropriate the funds and they have to change the eligibility. So I would say that the VA is very receptive to any way they can improve veteran oral health, but really the decision makers and the purse strings lie with Congress. So we'll actually be in DC next week, in just a few days, advocating for veteran dental care. There is currently a bill in the House offered by Representative Brownlee that would expand dental care for every veteran who is in the VA. I don't think it's likely to pass, but that's where I would focus efforts is outside of the VA and really putting pressure on our congressional representatives to do something for veteran dental care. Gail, go ahead.
I wanted to respond to the question also, and I wanted to say that first of all, thank you so much for this brief. This is wonderful. I see using it in what is our job one every single day here in our state, which is helping people understand what dental disease is, what is oral health, what is dental disease, because they can't work on policy and protocols, et cetera, if they don't understand what the mechanics are. So we do a lot of work around this is what decay is, this is what gum disease is, this is about bacteria, and this is about transferability. Then once they have that core information, then really they feel better informed in being able to make policy decisions. And we found that especially when we worked on our adult dental benefit a couple of years ago, we got it in place. Actually, it's about 28 months right now. But one of our legislators who was a very, very staunch to the right conservative came in one day and started talking about dental disease, and it just opened up the conversation because it started to take away the blame, et cetera. So for me, coupling that with this brief is going to be a wonderful, wonderful tool. So thank you so much. We do a poor job in this country of oral health mechanics and the literacy of disease.
That's fantastic, Gail. I'm so glad that you've met some success in having folks pay attention. And thank you for sharing that success story. That's really exciting. And just really quickly, Deborah, is there an opportunity to educate representatives on alternative models of dental care? Absolutely. And in fact, we've seen representatives offer pilot programs through legislation around using dental therapists or other types of therapy. And I think there's certainly utility in educating decision makers, including policymakers, about all of the options that improve access to dental care. So great question. And I certainly think that's an area of opportunity for sure. Okay, so I'm going to highlight 3 states that have all addressed veteran dental care a little bit differently. And I think this is a pretty cool little outline of opportunities here for policy at the state level. So Florida very recently passed, like in April, this was implemented, essentially a grant program within the Florida Department of Veterans Affairs. And this program is designed to provide dental care to veterans living in Florida by allocating funding, about $1 million a year, to nonprofit programs who provide free dental care to veterans. So the care doesn't go, or the funding doesn't go directly to veterans, but it does go to healthcare providers and systems who are giving care to veterans at no cost to them. So I think that's a pretty cool way of funding direct care. It certainly meets a need, and it also builds the capacity and infrastructure of providers in the state. Oregon is probably one that you've heard of. I feel like that's been a popular state to reference in this work, but they actually created an innovative Medicaid carve out for folks who don't qualify for Medicaid or VA benefits. And veterans are screened and then essentially entered into a community care program, like a network of providers who will get their care paid for if they're treating veterans in their clinical care network. So that's kind of a Medicaid approach to addressing veteran oral health. And then lastly, highlighting some of our work in Iowa, Iowa actually established a veteran trust fund through their lottery system. And it is a grant to cover out-of-pocket costs for veterans. So it goes directly to veterans and reimbursing them for care, including dental care, but other types of medical care for any out-of-pocket costs that they have. And that's funded through their lottery dollars. So in some states, working through Medicaid or working through the budget and appropriations process can be difficult, but Iowa certainly found a way around that, and this has been a really successful program. You want to learn more about Iowa? We've actually created an entire comprehensive look at that state through reports, through tools, through summits. We've done a ton of work in Iowa. And we like to highlight Iowa because this has been such a successful state in addressing veteran dental care. And other states could certainly work with us or do this work on their own in terms of a comprehensive overview of veteran oral health, which includes a report where we really did a deep dive on the data instead of just that state profile. And we hosted community forums and created an entire summit on veteran oral health to really get stakeholders motivated and involved. So we like to highlight the successes of Iowa as part of that. And then I know we have only a couple of seconds left, but I wanted to create this call to action, or rather call attention to this question, which is, before next month, can you share your state profile with one new person or organization? And if so, and you want to pop that into the chat so that other folks can see it too. If there's a person, an organization, or an entity that could benefit from this, share out. Okay. So before we close out, let me highlight our next steps, which are CEUs are available today's session, and they can be accessed at the AIDPH Academy. We will pop the link in the chat, but you will also get this link in a follow-up email. As I mentioned in the very beginning, any recordings and resources from today's session will be available on the Academy. And everything can be available, all of the state profiles and data are available at vetdentaldata.org, including that storytelling form. Next week, as I mentioned, is Open Till Day, and veterans are one of the policy issues on our advocacy docket. If you are unable to attend, which it seems like if you haven't already registered and planned, that would probably be difficult to get to DC on a whim, but there are options for you to participate virtually in veteran advocacy. So you can follow AIDPH. We'll certainly be promoting those via social media, but you can also go to Open's website and access all of the materials there and stay coordinated with this national virtual effort to highlight veteran oral health. Okay. Shayla's also put that into the chat. I see Robin and Gail are already planning on promoting, sharing the brief, and engaging in advocacy for Vermont. So with 2 minutes left, are there any other questions that we can answer or any other comments that folks want to highlight before we close out today? If not, I want to say thank you so much for your time and attention today. We care so deeply about advancing veteran oral health and improving oral health outcomes for veterans, and we're so glad to be partnered with the state of Vermont in those solutions. If there's anything AIDPH can ever do for you, please don't hesitate to reach out to us. And with that, we'll say thank you and goodbye.
Goodbye, everyone. Thank you.
Thank you so very much. Much appreciated.
Thank you.